Hey, what's going on, everyone? I wanted to talk about something. Today, I went to my pain management doctor. I usually go once a month for my medications. But today, they had a doctor there that's like a regional doctor. He said he goes to all of the pain managements to see how everyone's doing and to make sure they're doing their job. But today, he brought up, I've never been asked this before. He was promoting this. It's a implanted stimulator. It blocks pain signals to relieve chronic pain. So basically, he said they would put one in my shoulder up here, like by my back, and he said that it would relieve all of my headaches, but I don't get regular headaches. And this doctor I've never seen before, he asked me like a brief overview of my health. Like he didn't even look at my chart or anything or any of the notes. And I've been going to the same practice for several years now. And I told him everything what I have and what's going on, and he just nodded his head and he was like, "Well, if I implant this, you'll be able to get your quality of life back. This will help your Chiari headache." And he didn't even call it Chiari headaches. He kept referring to his headaches, and he's like, "You just have nerve issues. Everything else doesn't cause anything." And he was acting like a sales rep, but then he said he was a doctor. But he was pushing it so hard. And then I told him about my lumbar area. I told him my situation about that. And he's like, "Oh, we could put one down there for you too." And that I actually wouldn't mind because when my SI joint shot wears off after a couple months, the pain does get worse. But he again, he just wanted me to do this so bad, and they scheduled it for me to do the one by my neck, then 3 weeks later to come back and do one for my lower back. And he didn't tell me the success rates. He goes, "After we put the one by your neck, you'll come back to the office 3 days later, and you will, if it doesn't work, we'll just take it out in the office." He said he just puts a needle in and sucks the thing out. um that just shows again, these doctors, when you tell them about Chiari, malformation, or syringomyelia, they automatically tune that out, and all they think about is headaches, headaches. Oh, you just get regular headaches. um and actually, I'm not comfortable putting something in my inside of my body because every time I've tried something, something backfired. um it seemed like a real big money grab for them. He must be getting some kind of kickback, or the office or the doctors have to put these in on all their patients. He was going to every room, and I heard him with the patient before. It's like a sales pitch. Like they didn't give me the opportunity to say, "Well, let me think about this. Let me do some more research about it," or nothing. He was just pushing so hard for me to do it. And I think it's funny when these doctors do that. They want to do all these things to you, but they never listen to you about about anything. They automatically think what you have is nothing, and then you just put this in the nerve, and the nerve will stop the signal to the brain, and you'll be able to live a normal life. And it's not that easy. To me, this seems like kind of type of like a nerve block kind of thing. I've done nerve blocks before in my neck, and they've actually made me worse. So my neurosurgeon told me to stop taking those. He said he didn't want anything poking around my spinal cord either, because of my history. But I just thought it felt like the beginning of my journey when I saw a doctor, when you're trying to explain what you have, and they totally disregard what you say and say something totally different. It felt like I was doing that all over again. It brought back so many memories of being gaslighted by these doctors. He said he carries this thing around. He has it in his pocket. He carries it around everywhere he goes. And whenever he goes to an office, and he'll go and tell patients and make them get scheduled to do this procedure. I've never had that issue with this pain management before. They always tell me they can't do much but injections and medication. They say, "I wish there was more we could help you with." But it's just weird that today, all of a sudden, he said this will cure everything, and you won't have no more headaches, and you'll be fine. And how it works is, I guess, when they put it in there, if you start to get headaches, you put that there's that little module thing, you put it on top of where they put it in your skin, and it activates it, and you just leave it attached to it. And then when you're done, you just take it off. And he said if the headache comes back, you just keep taking it on and off. But it was so aggravating because I told him about my neck and have an MRI, and I was like, "Well, I want to get my results first before I start doing anything else." and I just said it's cervical fusion is possible because of my C2 disc, and right away he's like, no, 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 no surgery. You don't need surgery. You need this. You know, this will help you. Don't try to do anything else. But then he says, if it doesn't work, we'll just take it out. But this is why I spread awareness, because when you say Chiari malformation to them or Syringomyelia, you could literally see it go right over their head, and they don't even care what you say. He didn't want to listen to any concerns. My regular doctor was in there that I see every month, and he kind of had that look like me and him kept looking at each other, and he was giving me that look like he could tell he was a little frustrated, and he knows that it doesn't help, because last month when we were talking, he said, there's not much more we could do, just keep coming to your appointments. And I told him I get these flare-ups, I get dizzy, and he's like, it'll stop the flare-ups and you won't feel like that anymore. But these doctors need to get better training and knowledge about Chiari malformation, because you hear too many stories of people trying to tell doctors what they go through, and they just totally, it goes right over their head. And it's crazy to me that this time in 2026 that we have to deal with this kind of stuff from these doctors. They're supposed to be there to help us, but it seems like all they care about is money and just doing surgery and kicking you to the curb. But this is a little shorter video. I just wanted to bring this up and see if you guys been offered this stimulator thing from your pain management. I don't know if it's something new that they're doing or they're pushing, but the last time I tried something that they were pushing, I ended up getting real sick, and it caused me almost to get into I was about to have a seizure from a medication that they kept upping on me, because it said it was going to work on some other issues, but it didn't. As before, just if you guys been through this and have been offered something and it will magically cure your Chiari and your Chiari headaches with this little stimulator, let me know. Or you could just let me know what other things that doctors try to push on you. All right, yeah. As always, you guys take it easy.